I think this one's really important because we hear it every single day in the office. Do fillers migrate? So do they move? Do they spread beyond where they're injected? Are you hearing this one all the time, Smita? Hello everyone and welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. My name is Dr. Ashley Amalfi. I'm a board certified plastic surgeon in Rochester, New York. And I'm joined by my co-host and dear friend, Dr. Smita Ramanathan in New Jersey. Hi Smit.
Hello. How's it going?
Oh, so good. I mean, this filler series is so good. I mean, I hope you guys are just watching. They're like quick episodes. We're answering so many of your quick questions. And I think this one's really important because we hear it every single day in the office. Do fillers migrate? So do they move? Do they spread beyond where they're injected? Are you hearing this one all the time, Smita?
All of the time. All of the time. And, you know, the sad part is also, is I see it all the time in patients that sort of come in from other injectors and have, you know, starting to see issues with it migrate. So, but yeah, I think this is so important to talk about because it is an issue, but completely avoidable and happens more on the rare side than anything, I think.
Yeah. I mean, it's all about putting the filler in the right place where we want it and choosing the right filler for the location. Because if you're choosing the wrong filler, it's not accomplishing your goal, then it can migrate. But I think most of the time it's not that that it has moved, it's that injector has put it in the wrong spot or misjudged some of those anatomic landmarks, which is why I think it's just so important that you know your injector and you do your homework and you make sure that they are qualified to be doing that. Do you agree?
1,000%. I mean, I think you're totally right. I think it's the combination of their right filler, right? For example, I think I see it the most common in people that have had a ton of lip filler, right? And I think it's sort of trying to get a little bit of that border, which, you know, every once in a while in the right patient, I'll just do a little bit of filler there just to sharpen it. But if you overdo it, or if that's the only place you're putting the filler, well, yeah, it's going to end up on your upper lip, you know?
Yes.
And that's using like a thicker filler. Yeah.
That's like the duck lips, right? So we just did an episode where we were like, people were like, is filler going to make me look like I have duck lips? No, but if they inject it beyond the border and it is bleeding, like it's looking like it's into a tissue that it's not supposed to be into, then it's not really that the filler is spreading, maybe just a little bit, but that it was just injected beyond the anatomy where it should be, which is why like those very small nuances are so important.
So important. But yeah, I mean, I think so using the wrong filler in the wrong place, like not understanding the anatomy, like you said, right? So if you actually inject it somewhere where, you know, it shouldn't be injected. And then the amount of filler too, right? I mean, sometimes it can seem, especially if we're doing the cheeks or the jawline, like we're using a lot of filler. Those areas obviously take a lot of filler because you're injecting it right on the bone. But, you know, if you're injecting like 3 cc's of filler in your lips, well, your lips are not going to hold that, right? Or if you're putting a full syringe on your eyelids, you're going to have issues. So, you know, I think it's the amount, knowing the anatomy, so injecting the right place, and then the exact, you know, filler, making sure you're using the right filler. If any of those are not in line, then yeah, you can have issues. But oftentimes, like you said, it's not migration. It's just that it's sort of in the wrong place to start with.
You nailed it. Those are the issues. I mean, that's why it isn't doing what we want it to do, and why it's so important that, you know, you have the right person doing your injection. So hopefully you realize this stuff isn't spreading under your skin. It's not creeping and crawling and going to other places. It's just a matter of getting the procedure done the right way, the right time, and the first time, so that we're not kind of chasing our tail with all this stuff.
Exactly. And what you don't want to do, which oftentimes happens, I think, is try to correct migration with just adding more filler.
Yeah.
I mean,
No.
at that point, you just dissolve, right? Dissolve everything and start new.
Then we're chasing our tail. Yeah.
Yeah, more is not better, like you said before.
All right, you guys. Well, I hope you understand how filler works a little bit more and why it's so important to get it right the first time. Stay tuned. We have so many more questions to answer about injectables and fillers here on Lipstick and Lipo. See you soon, Smit.